think people, when they come to see me, they have a sense of whether they're comfortable with an artificial material in their face or not. One of the things that people may wonder if they're sitting on the fence and they're undecided as to whether they're comfortable with that idea or whether they prefer sliding genioplasty where we reshape their own bone is how often do I have to take these implants out? With the porous polyethylene, once again, that allows blood vessels to grow in and therefore has an ability to fight infection, if you will. Antibiotics can actually get into the implant. I have, in all of the chin implants that I've done, have never had to, one is never supposed to say never in medicine, but I've actually never had to take one of those implants out. And I've done many, probably in the close to thousands now. The reason, I believe, is because it becomes incorporated into the body by this growth of vessels into the implant. That's not to say I haven't had infections with them. There's still infection, but with the infection I've been able to leave the implant in, treat the patient with antibiotics. On occasion, the number of times I can count on one hand, I've had to take them to the operating room to wash out the area, but I've been able to leave the implant in. That's a big bonus for patients because although it may mean one operation, a small operation to clean things out, they're able to keep their implant, they're able to keep their result. And the number of times, again, that that's happened is minuscule. So I think the big concern for patients, generally, in my experience, is the worry that the implant might have to come out, that this operation will not work. The main reason for that is infection, and my belief, and I think it's supported by science and studies, is that with this particular material, porous polyethylene, it seems to have a much lower risk of infection, and therefore the risk of having to remove the implant is low.